All right, welcome to the High River and District Healthcare Foundation social media and our next healthcare conversation. Friends, believe it or not, we are all the way up to episode number 9 of the conversations we've been having in community. And we're so excited that you could join us, whether you're with us live today or catching the replay later. We appreciate you joining us with another community healthcare conversation. My name is Jody Seeley, and our guest today we have down of like, I feel still, no matter how many of these things we did through the pandemic, I still feel like I'm hosting a game show. So over in this corner over here, we have Dr. Warner, who is our chief of staff at the High River Hospital. He also sits on the board of directors with the Hospital Foundation. So Dr. Warner, thank you for joining us today.
Thanks for the invitation.
Up in the top, we have Meighan, who was our summer intern extraordinaire at the foundation, and she's also out at UBC as a kinesiology student. So we're tapping into her medical brain today instead of her intern brain. Meighan Prosser is here. Thank you, Meighan, for joining us.
Thank you for having me.
And the winner of the funnest office background of all time, Jocelyn, is with us too from the town of High River. She is with our Parks and Recs department, and we're just so excited to have you here today, Joss. Thank you.
Thank you.
All right, so our topic in the month of August is called physical literacy, which I feel like sounds like a doctor term, Dr. Warner, for being active, really. Is that what we would break down? Like, can we start off with being, okay, what exactly, when you say physical literacy, do we even mean by that?
So we spend a lot of time at school teaching kids how to read and write, but we don't always teach people so much about how their body works, how to use it, how to get the best bang for your buck out of it. So, if you think about how you move, how you pick things up, how you lift, how you climb stairs, if you watch little kids, they're learning that, right? They start off not knowing how to do it, and they figure out the best way to move. They're very flexible. As we get older, we kind of forget a lot of that stuff, and we forget how to function and how to do things best. And that's something that, as an adult, we need to be aware of. Your physical literacy, your how do I do things in a way that's good for my body, that's going to make me stronger, not going to make me prone to injuries. And so it's something kids get that they're learning that we forget as adults.
When I think as we age, we have a nice variety of ages on this conversation today, but I feel like I've had a lot of conversation with people lately who kind of over that 40-year level mark, the things that we used to do with bodies don't work the same anymore. And all of a sudden you're like, oh, I can't do that the same way that I did before. Is that part of sort of recognizing the changes as we age also?
Yeah, I mean, I found probably the same as you. I hit 40 and suddenly the warranty was up and everything stopped working.
Yeah, exactly. It got really rusty. Yeah, really fast. Yeah.
And it gets more and more important as you get older. So when you're young, you've got a lot of ability to adapt and adjust to things. As you get older, injuries have more of an impact. So it becomes even more important to avoid getting hurt and more important to keep moving, keep everything working well so you don't take injuries. Because you heal slower. When you're 20, you're indestructible. You can fall off things, jump up things, and you're grand the next day. Now I spend a lot of time crying on my couch after I've been too active.
Yeah, it's like, I don't know where the warranty went on knees. Like, knees are the worst, but we could go on and on about that. But Meighan, from as being a kinesiology student, this is a lot of the stuff that you're learning and figuring out and will eventually be helping more people with. What does physical literacy mean from your perspective?
So for me, in kinesiology, the physical literacy side is also kind of people understanding, I think, why we exercise and like the effects that that also has on the body, and understanding that exercising decreases your chance of different chronic diseases developing. It reduces your risk of type 2 diabetes, cardiovascular disease, all of those things. And so understanding from that perspective of like when I exercise and I move my body like this, it is decreasing my chances of this happening in the future.
Right. And I think too, I don't know whoever would like to answer this one, but where do we get that knowledge and how do we find out ways that is that from taking classes with different people? Like, how do we know as we age? Like Kathy made a comment and they're saying, wait till 50, you just start to fall right apart. So how, as we age, do we learn and teach ourselves the literacy we need for our bodies?
I think something like for people to learn, there also kind of has to be like that access portion stuff, which I definitely, for me myself, that's like what I'm working towards, is like to open that access so that people understand where they can get that information, because the things you're taught aren't always really public knowledge. And also it's accessing how do you exercise, how, like, where do you even begin when you're starting that, because these numbers are thrown out there and they look really big, like 150 minutes a week. That seems like a lot, and I don't think people understand kind of how to break it up. So I don't know if anyone else wants to jump in and add to that.
I'll say one thing from a rec side. So for us, our physical literacy standpoint is the confidence, the motivation, and the competence to exercise or to be physically active. And for us, especially here, that's at any age. And it's like you said, Meighan, giving people that access to learn to be motivated or learn to be confident or competent in a skill, and then to return to it. And then our overall goal is active for life.
And I think that sometimes we forget in, whether it's the community that we live in or anyone who sees this in any community, is that we do have rec centers and programs. And I mean, the fall guide just came out for the rec center of a number of ways that you can add into your physical literacy, but we forget that we have access to those. Yeah, it's so beautiful.
Thank you.
And it's full of so many options. Like, I don't know, as a doctor, Dr. Warner, do you find that when you see patients, like, people forget or maybe even don't know sometimes all the different ways that you could add? It doesn't have to be that traditional mindset that you have to go to a gym and walk on a treadmill for this many minutes, this many times a week, that you can get really creative with it.
Yeah, remember, everyone's different. And some people want to be gym bunnies and get a lot of muscle. Some people just want to be able to go out and dance with their friends. And the nice thing about a community like ours is there's so many different ways that you can find together. You can get a running group or a walking group. You can go to the rec center for swimming. There's so many different programs. You can find something that suits you. If you're kind of like being on your own, you might want to have an activity that you can get out and walk and run on your own. But if you like friends, like, we know the best way to make people keep exercising is to be doing exercise with their friends. So knowing that there are groups out there is really helpful. So you can find people who think the way you do and have a good time with them. And as a side effect, get really physically active and moving.
When I feel like all three of you could probably put some insight to the next comment or question I have, in that I feel like probably one of the key factors in this whole the whole physical literacy equation is when we drop the word confidence through that. And I think no matter the age, the confidence is the factor. So how do we sort of kickstart into addressing that piece of it? Don't all answer at once.
It's like, confidence is such a tough one because it's different for everyone. Like, some people literally need the confidence to walk into the rec center or a gym. The one thing that we say with the rec center too is a lot of the things that we offer, at least in our level, user groups are a little bit different, but we try to be non-competitive. So what we're offering isn't as intimidating as potentially walking into a gym. And then we try to be accessible here, that if, like, people need a tour just to walk around, and maybe that makes them feel better to be partnered up with someone. I think Chris touched on how people like to do things in group settings. So we try to offer that. We try to buddy people up to learn how to play pickleball, just to try and help with that confidence. Because like you said, it is a challenge.
Any other comments from you two?
I think for me, like, a suggestion when we kind of talk about confidence and everything is it's kind of telling our clients to start small and work your way up. So say you wanted eventually to go to a gym and start weightlifting, but you're nervous about doing that, doing a dumbbell workout at home. So you kind of get used to like those motions and understanding. And then when you go into the gym, you have a little bit of confidence because you know how to kind of lift weights and everything. So
yeah, I like that. And I think too, it's just remembering, Chris, I'm sure you probably say this to a lot of your patients, is just start with just going for a walk. That is the simplest, I think most of us have confidence in walking. I'm not always so graceful, but we have that. And that's really just an easy place to start and then begin to build. Would that make sense?
There's a Dr. Schnell, who's a cardiologist, who kindly comes and does some clinics for us here. He said he wishes all of his patients had dogs because it makes you get out and walk.
Yeah.
And just simple walking, it's great for your posture, for your core, for your legs, for your arms. It's simple, doesn't cost you anything.
Yeah.
But some of our patients really struggle with confidence. If you've fallen down a bunch of times, you've broken limbs, and broken legs, it's tough to get the confidence back. And that's often where an organized class, where you got some supervision, someone's watching you, can really help. Just having resources available for people who actually are scared of walking.
Yeah, no, I love that. So I think we have lots of great access points within the community. So anyone who sees this, and just because lots of times we don't know what we don't know. So if we have no idea what's available in the community, we don't know how to access that. So whether it's through asking your doctor for information, or checking in with the FCSS office, or checking in with Parks and Rec, you can get all of that information. And a really cool program that will start, that's in that beautiful fall guide that Jocelyn was showing us earlier, that we're really excited about from the foundation's point of view, because it's something we sponsor, is the Grade 5 Get Active program. So Jocelyn, tell us about what this is.
So this program we started in 2018, and basically, like we were talking about with confidence, the idea came from studies show that kids start to not participate in physical activity around the age of 10 to 12. So we're trying to target grade 5 students before they potentially start to lose that confidence, and get them in our building and maybe doing some drop-in activities. So they have free access to the building, sponsored access to the building, whether they want to do skating, swimming, field house. Any of our drop-in activities are sponsored by the foundation for all grade 5 students for the entire year. So the September to August. So this year we're coming to our 3rd time doing it. And we're just really excited to get those kids back in the building. They love it. They use it. And I can honestly say that I see their confidence grow, and they come back. Like even through summer, we don't offer our youth after school sports time. And it's usually from 4 to 5:30. And 4 to 5:30 in the field house all summer was still filled with youth.
Yeah.
Even though it wasn't designated to them. But that just goes to show it helps build that habit.
Yeah. So how do people get, okay, I've got a grade 5er this year. How do I get them registered?
So we've already had calls, which I love. But what happens is that first week of September, I contact the schools and arrange a time for myself to come there. And then I give each kid a brochure, and then they just have to have their teacher sign it. And then they bring it into the rec center and they get their card. We also do it for any students that are homeschooled. So any student that is homeschooled, they can just contact the rec center and I'll deal with them directly. But I will come to the school and get them their brochure, and then they will be able to come to the rec center.
I love that.
Yes.
And I would feel, Meighan and Chris, from a medical side, this is probably really exciting for you to see sort of the ripple effect that getting kids involved in it will do.
So we know that health in kids growing into adults is, if you eat well as a child, you're probably going to eat well as a kid. If you exercise and engage in sports as a kid, you're probably going to continue that through into adulthood. So you get them young, they'll do well. So the more we can get these kids involved, they'll find a niche, right? Not every kid likes skating, not every kid likes running, but with a bunch of offerings, they can find something that they love doing. And if you love something, you're going to do it. So give those opportunities to them when they're little, and they'll take it through.
Yeah. Well, and I feel like nothing builds confidence. But I mean, all kids are different, but I think of my own son in this scenario is that anytime he's had the opportunity to learn something or try something new or be involved with something, they bring that home and they want to show you how they do it. So in that, I think it's for us as the adults. So whether you're the guardian, the parent, the caregiver, the grandma and grandpa in the scenario, is try it with them, because that's going to allow you that safe space to give something a go. And who knows, maybe you rekindle a passion from your childhood that you forgot how you love to do, or whatever that might look like. So I just feel like it's a really exciting way to kickstart it, going all through the ages. So fun. All right. We're chatting about physical literacy today. Does anybody else have anything they want to add before we let people get out to go for a walk?
The walking track is free all year round.
Yes. And not intimidating.
It's not, yeah. And you can use a walker or a wheelchair or a stroller, fully accessible. Yes.
And that's really, really important for our older patients. Just being able to walk, we encourage people to walk, but you don't want them to walk on the ice and hurt themselves in winter. So just being able to get out, it's just so important for your mental health as well as your physical health. So that's a lovely thing to have.
Yeah. Meighan, any last words from you?
I think if you're wanting to change your habits around exercise and wanting to get out more, just start small. Even adding 10 minutes a day into your schedule of whatever you're doing is going to make a massive difference in the long run. So yeah.
I love that. Well, and just trying to keep really connected into what's happening in community. An example that always comes up in September is the Terry Fox Run. And I think when we hear things like run, we get a little intimidated by what that looks like. But at the end of the day, that's a group of community people who are putting on an active event, and you can walk that route. You do not have to run. And therefore, I feel like things like that can sometimes be an interesting inspiration, in that that you're giving to a good cause, and then you're also giving to the cause of yourself at the same time. And you get to go out and meet some people in your community and have some fun with it. So keep your eyes peeled for events like that, which you'll find all over, especially the town of High River Parks and Rec social media. They are always posting really cool options and ideas. So just a suggestion. And we encourage you to share this conversation onto your social media platforms. The more people that we can give more information to, the better. So keep sharing. And to our special guest today, thank you so much for taking some time to chat about getting ourselves a little bit more active this fall. I hope you guys have a great day.
Thank you, Jody.
Thanks, Jody.
Bye, everyone.